Welcome to the Low Carb Conferences podcast. I'm your host, Dr. Jeff Gerber. And today our special guest is Dr. Ken Berry, who will be speaking at our conference in February 2023. Ken and his wife, Nisha, have been big supporters of the conference in the past. So how are you doing today, Ken?
Doing great, doctor. Good to talk to you again.
Same here. So Ken is a family physician, author, podcaster, social media influencer, and is passionate about addressing prevention and health via diet and lifestyle. We know Ken has a huge following, as many of our patients here in Colorado have found us actually through Ken's work. Thanks, Ken.
No, that's what I do, doctor.
Yeah, and also to say that we love the Southern twang in addition to the message. So Ken, if you can give us some background and tell us more about your personal and professional interests and passions.
Sure. I'm a family physician. I've been practicing family medicine uninterrupted since I graduated from my accelerated residency in 2002. So over 20 years now, I've been doing this. And for the last few years, you may or may not know, we had a fire at our clinic, the clinic was basically our life. Every waking moment was spent either in the clinic or thinking about the clinic or planning for future plans for the clinic. And we had a fire and lost the clinic completely. And so I was already doing some social media, but my wife, Nisha, who has been my rudder since I met her, she said a very curious thing to me one day when I came home from the clinic. She said, "How many people did you help today?" And I said, "Oh, I don't know, 30, 40, And she said, "Oh, that's good. I'm proud of you. What if you could help 3,000 people a day? Wouldn't that be cool?" And I'm like, "Well, yeah, but I mean, there's not enough hours in the day." And she said, "Oh, contraire, actually there is. If you started making YouTube videos and basically just talk to the camera like you're talking to a patient and explain these complex medical concepts and nutrition concepts, if you just explained them in everyday English so people could understand them, and then as soon as the video's over, they could start to implement those things immediately without buying a bunch of supplements or signing up for a program or having to wait for an appointment or a prior authorization, right? Then all of a sudden, you could help a lot more people. And initially, I was very resistant. I'm a doctor. I'm not going to make YouTube videos. That's dumb. But the more I thought about what she said, the more I saw the wisdom in it. And so I started making YouTube videos. And I think that my YouTube channel's growth is evidence that the average person out there is completely confused about which diet is best, what nutrition, what should I eat, what should I avoid. They've heard so many mixed signals, very often conflated by big pharmaceutical companies and big food manufacturers, that they've just given up. And there are many doctors in practice today, as you know, Jeff, that if you try to talk to that healthcare provider about nutrition and how they should implement that as part of their practice, they're like, it's a waste of time. Patients don't care. They don't listen. And what I have found almost uniformly is that's not true. Now, if you're giving a confusing, complicated message that involves spending lots of money and spending lots of time, effort, and motivation for minimal results, yeah, people aren't interested in that at all. But if you can give them a simple step 1, step 2, step 3, that doesn't involve them spending a lot of time or a lot of money, and will give them noticeable results in the short term, right? So they can do this for a few weeks or a month or two and be like, bam, that's better. Wow, this really works. I think the average person out there driving their truck or fixing hair or fixing breakfast, whatever they're doing, they're very interested and very motivated in a simple nutrition and healthcare plan that gives them results and that is sustainable. Who's not interested in that? You'd have to be a moron not to be interested in that. But the average doctor who's given such terrible nutrition advice for years, if not decades, anytime they give nutrition advice, they see their patient's eyes glaze over because the patient's like, "Yeah, I've already tried that 10 times, doc. That don't work for me."
Yeah. Well, that's a beautiful transition from clinical to going out on social media, and it makes a lot of sense. And it's interesting to kind of contrast the two of us as family doctors. So I've kind of had the same path. So it started with a patient, then it started with a lecture, then it started as an author. And now we have these conferences where we, instead of talking to the one person in front of you, we can talk to the many. But in contrast, I've actually stayed in the healthcare system.
Yeah.
And I've been at it now almost over 30 years, actually. And
Wow.
yeah, I've been at it for quite some time, really promoting nutrition for well over 20. Because initially, like you said, I had the same advice that other doctors had that just weren't working for people. And so I we discussed previously that I would describe you as being somewhat of an anti-establishment individual, especially with the title of your book, Lies My Doctor Told Me.
Yeah.
And look, I think it's great. And I think that we need to come at this at all angles. So from within, we need to make change from within and outside the system. What are your thoughts?
Yeah, I totally agree with all of that. I still maintain a small private, closed private practice. I have a few patients who I've been taking care of for decades who are either shut in, can't get out of their house. And so rather than make them find a new doctor, I'll see them at home. But the majority of my time is spent trying to reach and educate the masses of people out there who have no idea what a proper human diet is. But definitely we have to have primary care physicians who are seeing the patients every day. Now, and you spoke about the establishment, and I kind of have always been a bit of an iconoclast. But I think in light of recent events over the last few years, I think a very large percentage of people, not just in the United States, but over the entire planet, are very disillusioned by establishment advice and recommendations and proclamations from on high. A lot of people are disenchanted with that, and they are not interested in perhaps what the World Health Organization thinks they should do, or what the American Medical Association thinks they should do, or the American Diabetes or Heart Associations. People, I mean, to be fair to the common man, these organizations have had decades, if not centuries, to get their message right and for their message to have had a noticeable result. Am I right?
Very much so.
I mean, these organizations have been around for a long damn time, and they've had millions, if not hundreds of millions, if not billions of dollars to throw at the problems of metabolic disease, obesity, hypertension, type 2 diabetes, fatty liver, childhood obesity, childhood type 2 diabetes. They've had all the time and all the money in the world to solve these problems. Yet, under their tutelage and their time in office, so to speak, it's gotten worse. And it hasn't gotten just slowly worse. It's gotten progressively, in some cases, almost logarithmically worse. So either they're a terrible messenger, which would be hard to believe since they have $1 million ad budgets, or the message that they've been giving is just wrong. And I think that that's what when the common man or woman finds one of my YouTube videos about a particular topic that they're searching for, if they're hungry and they're ready and they watch my video and they're like, huh, I've never heard it put that way before. I've never heard that advice before. I'm going to try that for a month or two and see what happens. Well, guess what would happen if my advice were inaccurate or wrong? Then I'd be in the same boat with the American Diabetes Association, wouldn't I? Everybody be like, yeah, he's a kook. He didn't know what he's talking about. That didn't help me at all. And they would stop listening. But I think I have 2.2 million followers and hundreds of millions of views and hundreds of thousands of comments saying, basically, to paraphrase, oh my God, when I watched your video, I thought you were a kook. But nothing else has worked, so I thought I would try it. And after a month or two or three, guess what? That particular disease or symptom or whatever that you talked about is so much better now. Thank you, Dr. Berry. And so I don't think it's as much about me as it is about the message. and about the simple steps. This is what you can do to reverse your type 2 diabetes. I think the American Diabetes Association is allergic to that term, reverse type 2 diabetes. They don't even want to say it out loud for fear they'll have to look for their EpiPen, right? Because they'll start having hives. But people want to reverse their type 2 diabetes. They don't want to manage it. People want to reverse fatty liver. They don't want to manage it. They don't want to wait for big pharma to take another 5 to 10 years to come up with an FDA approved fatty liver pill that will half-ass work in 10% of the population and cause a 3-page list of side effects. They don't want that. They just want their fatty liver to go away. They want it to be relatively simple, relatively affordable, sustainable, and they want it to actually work. God forbid, somebody should want something to work consistently. And so that's what I try to offer people. But we definitely need men and women in the trenches like you with all those charts behind you. It's kind of causing a panic attack just seeing all those charts and thinking about all those souls that they're going to call Dr. Gerber, and they can't just leave you a message on a YouTube video or become a patron and leave a message. They're going to call your office, and you got to pay a staff to answer the phone. Oh, yeah. So I honor you in the work you're doing, and the hundreds of thousands of other healthcare providers out there, many of them who, let's talk about this, they're stuck as an employee of a huge healthcare corporation or a hospital corporation. And so they are not at liberty, even though keto may have completely reversed all of the doctors' chronic health problems, right? They may be doing keto on the daily. They can't really just start recommending it to their patients out loud officially because they will get yelled at by their corporate daddies, the powers that be that sign their check. And so I've had so many healthcare providers like you, nurse practitioners, physicians assistants, and other paramedical health people, nurses, physical therapists say, well, according to my corporate guidelines, I have, when I'm discharging a patient or when I see a patient in the clinic, I have to cover these bullet points. But when I get finished doing what the corporation says I must do, then I hand them a pamphlet with your YouTube channel and your book and Dr. Gerber's clinic if they want to, transfer their care. And so a lot of people are doing this ninja level stuff at the professional level because they'll get yelled at like a child if they are too big of a vocal public proponent of keto or ketovore or carnivore. They'll get in trouble with their bosses. And so they have to surreptitiously basically give the bullshit information at first that they've been given for the last 20 years that hadn't worked yet. And then they actually give meaningful information at the end of the interview or the discussion and say, when you get home, Google this. And so, as a healthcare provider, you have to help your patients in whatever way you can. So I applaud you and honor you for staying in the clinical setting full time. And everyone who does that, it's definitely a calling. I did it for over 20 years. But I think a doctor on social media giving the truth in digestible nuggets that's quickly implementable and gives pretty quick results, I think that's probably also a calling. And so I think you and I are both doing some good work.
Yes. Well, listen, that is well said, Ken, and I really do mean that. And so if the medical authority is the man, we're sticking it to the man is kind of what your message is.
Yeah.
And so we need the voice, your voice in particular, to make that message loud and clear. And again, thank you for your comments as to what we're doing on this side. And so, I would say that in our office as a doctor, we own our business, and so we really do have some pretty good flexibility in terms of the things that we talk with patients. But some of your comments are definitely an issue when it comes to hospital systems and big medical institutions where you have to be careful what you say. Now, for me, though, I'm trying to walk this fine line, and that's why I want to have this discussion with you. So when we have these medical conferences, we're actually trying to appeal to the medical authority. We're trying to bring about change. And so the thing is, how do we deal with that? So we want to get these the conference is approved for educational credits. And so we don't want the authority to say, well, your presentations are too controversial. And so we want a message that is perhaps evidence-based and wouldn't be offensive. And I tell you, we've actually been at conferences where some of the healthcare professionals were offended by the comments of the speakers. And so I think you know better. And so, how do we find that balance? So the other aspects which you didn't mention is that your presence on social media also educates healthcare professionals. And that's as well as the general public.
Yeah, and I've had multiple healthcare providers at all levels of practice reach out to me. I've had medical students, resident physicians, and then tenured academic physicians reach out to me and say, "I saw your YouTube video about this, that, or the other," and I was going to write it off as foolishness, but then I noticed that you had 7 links down in the show notes to research studies. And you know as well as I do, Dr. Gerber, that many chronic medical problems are intimately related to hyperinsulinemia. And so many doctors they're like, hyperinsulinemia, you mean like with a tumor, with an insulinoma? And I'm like, no, from eating too many carbohydrates in your diet. That keeps you chronically, your insulin chronically elevated. And it's an epiphany for these people because their paradigm just doesn't include that possibility. And so when they hear that at first, they're like, that can't be right. But then they see, oh, on your acne video, you've got 5 links to research showing that acne and hyperinsulinemia literally go hand in hand. So many fatty liver, type 2 diabetes, on and on and on, psoriasis, keratosis pilaris, rosacea. Literally, there's reams of research in the literature that they go hand in hand with hyperinsulinemia. And when you correct the hyperinsulinemia, they either get substantially better or seemingly go completely away. And so I think I'm trying to reach the masses, definitely. But in the process, I've picked up a lot of healthcare providers. I just did a conference with 2 nurse practitioners in Dixon, Tennessee, who both found my videos and reached out to me and said, hey, we love what you're doing here. And now they incorporate that into their medical practice. And so I think that more and more, that's the real power of this. Because if I reach 100 people and I fix their health completely, they've got normal metabolic numbers, everything went back to normal and they feel great, that's good. That's a job well done. But if I can reach just one healthcare provider, Jeff, and make them see the light, that, yeah, maybe the ADA and the AHA, maybe they've gotten this all wrong. Maybe the answer is not a handful of pills. Maybe it's food and lifestyle. Maybe that's actually what it is. And then when they see the research links in the show notes, they're like, oh, I can cut my teeth on this. If this Barry guy's full of shit, I'll read this research and I'll immediately know that's baloney. That's not right. But then they read the research and they're like, crap. How have I missed this for 5, 10, 20, 30 years? And so when you open that doctor's eyes and you shift their paradigm, guess what you did, Dr. Gerber? Now, how many patients are in their patient panel? 300, 500, 1,000, 5,000? It depends on their specialty, right? And how busy they are. But now you've reached into the lives through that healthcare provider to every single one of those patients. And I never have made a single YouTube video for a healthcare provider, except the one where I talk about why I don't talk to drug reps, which I think got 20,000 views. It's one of my lowest viewed videos, but that was 2 healthcare providers. But the vast majority of my videos are to just the common man and woman on the street with a job and a spouse and a dog trying to improve their health. But what has happened is I've had lots of healthcare providers see my videos, reach out to me, look at the research, and then adjust the way they practice medicine permanently. And I think that in the long run may be a more powerful thing, not only to help all of their patients improve their metabolic health, but also for your goal, which is to shift the guidelines at the top, right? To make the American Diabetes Association hold that press conference and say, you know what? we were wrong about type 2 diabetes for all these years. You should not have oatmeal and a banana and 2 slices of whole wheat bread for breakfast. If you're a type 2 diabetic, you should not do that. You should have bacon and eggs. I can't believe I just said that, but Dr. Berry's right. You should eat bacon and eggs for breakfast. It will help you reverse your type 2 diabetes. And I don't hold my breath and wait for that to happen, but I think one day they'll quietly back away from the lots of fruits and vegetables and whole grain breads. They'll back away from that, and they won't talk about that anymore. And they'll probably try to emphasize low fat proteins first, right? Because that's still sort of acceptable. But at some point, they're just going to have to say, yeah, Barry was right. Eat the bacon and eggs.
Yeah, well, I'm happy to say, Ken, that we actually have representatives from the ADA that attend our conference. And we have communication, we interact, and low carb is actually in the guidelines.
It is
and
on page 271.
there you go. And I think the CFO or has promoted low carb of the ADA has promoted low carb on social media.
She did for a moment. Yeah, that's their previous CEO, Tracy. I forgot her last name, but she is a type 2 diabetic, and she did use a low carb diet to greatly improve her A1C and other health markers. And she talked about it on a podcast. And then magically, she never talked about it again. And I reached out to her on Twitter multiple times, like, hey, come on my channel, let's talk about a low carb diet. Now, you would expect, the CEO of the American Diabetes Association, if they were truly interested in reaching millions of type 2 diabetics and helping them lower their A1C score, she would have jumped at that, but she had zero interest in talking to a doctor who specializes in reversing type 2 diabetes. She had no interest in that. And now they have a new CEO, Dr. Bob, who is, a little bit overweight and has type 2 diabetes. And I've reached out to him multiple times on Twitter. So I might hear from Dr. Bob. I kind of doubt it. But yeah, I think there are multiple people within the machinery of the American Diabetes Association who absolutely know that a low carb diet is the diet for a type 2 diabetic, or for a type 1 diabetic for that matter. They know that the research is becoming increasingly clear on almost a weekly basis, with a new study coming out about low carb for this, keto for that. Right now there's over 300 keto studies that are either ongoing, in process right now, or are planned and already have received ethical approval and are going to move forward about hundreds of different healthcare problems. And so I made a video recently on my channel saying, why won't keto die? Because I overheard that comment at a medical conference. One of the docs said that to another doctor. They didn't know I was sitting right behind them. And so the reason keto won't die is because it works. It's easy, it's delicious, it's sustainable, and it's relatively affordable compared to all the copays for all of the pills and injections and infusions and all the medical procedures and all the lost income that you're going to reap if you just let mainstream medicine manage your type 2 diabetes, instead of giving me a chance to just reverse it completely and get rid of it.
Yeah. Well, look, Ken, I agree that a low carb diet is really the preferred approach when somebody has insulin resistance. And, I love to throw out the terms that if somebody's diabetic, you put them on a proper low carb diet, you can treat, reverse, and cure diabetes. And
Yes.
like you said, the healthcare professional, the authority hates that, because there's really no medication that can address that.
Not even close.
There's bariatric surgery, but that you're cutting out, healthy
Right.
parts of your body. So we don't want to do that. But just to be the devil's advocate, there seems to be a dichotomy that, there's this concept of, the insulin and the hormones, and then the calories and the energy balance. And, at our conference, first of all, you don't know who's going to be in the audience.
Right.
And we want everyone to be in the audience, because the theme of the conference is, where is nutrition headed? And so we're going to present some different perspectives of things. And so the idea, should there be a battle between these two factions, or do hormones calories and energy balance, does it all matter?
Yeah, and I'm firmly in the camp that hormones trump the calorie in, calorie out model. So whether you eat keto and that you're so satiated that that leads to a calorie deficit, or as you and I have both seen in hundreds of people, they're obviously eating in a calorie surplus, but somehow still burning fat and still improving their numbers. We've all seen those cases. Now, maybe they're lying. I'm not sure why they would, but yeah. So, but regardless, I don't care. As all I want is for the patient to be able to easily, affordably, attainably reverse their type 2 diabetes and keep it gone for the rest of their life. That's my goal. And so if that requires a calorie deficit that they don't have to think about and count, which could be, I'm totally fine with that. I don't care. Or if they're able to attain that in a calorie surplus, which seems to many people to violate certain laws of thermodynamics and to be physically impossible, I don't care about that either. All I want is for people to be as healthy as they can possibly be, reverse their type 2 diabetes and other chronic conditions, and not be in a state of semi-starvation for the rest of their life, because that's the diet that we alluded to earlier, that the healthcare provider says, well, you need to eat less and move more, right? You need to join the gym and join Weight Watchers. So basically you're telling this patient effectively, and they'll argue all day long, but what's the effective message is to eat, do not ever eat until satiety. Stop eating before you're full. So first of all, is there any other mammal on the planet that does that? No, there's not a single example of that in the wild. All mammals eat until they can't eat another bite, then they go take a nap. That's how they live their life. We are mammals. We should also be able to do that. If you're giving this patient false healthy food choices, so you're saying things like, well, don't eat white bread, eat whole grain bread, and don't eat white rice, eat brown rice. And, don't, if you eat bananas, make sure they're not completely ripe. This is the kind of bullshit advice that people have been getting for the last 30 years, Jeff, and it hasn't worked. So maybe we should scrap that all together. And I tell people routinely, if you even can't, I don't even want to hear about your calorie count. I don't care. I don't want to know. And increasingly, now that I've kind of adopted the principles of a proper human diet, that new model, I don't even care what your macros are. If you're eating these foods and eating until you're comfortably satiated and can't comfortably take another bite, and all of your health markers are improving, right? You're feeling better, you're looking better, you're sleeping better, everything's better. I don't give a damn what your calorie count is. I don't care what your macro count is. I could care less about any of that. No other mammal on the planet counts calories or counts macros. They don't use a ketone meter. They don't use any of that. They just eat the species specific diet that they are meant to eat. They eat until they're full. If they're not hungry, they don't eat. When they get hungry again, they start looking for something else to eat. Human beings in the wild, this is our wild currently, right? With iPhones and ring lights, we get to do that same thing if we're eating the right foods. If we're hungry, we get to eat. We eat till we're full. When we're full, we stop eating. And then we don't think about food again. We get to go play and have fun and do whatever, be productive, be creative until we're hungry again. And then we eat again. And so that message sounds pretty common sense, right? Like, yeah, okay, every other mammal does it. Why can't we? But that message is revolutionary when it comes to what big pharmaceutical companies think about it and what big medical practices think about that message, and what big food companies, they don't like that message at all. Maybe big food does. They just want you to eat all the damn time, right? But everybody's like, what are you talking about? Eat when you're hungry, eat till you're full, and then don't eat again until you're hungry. That's revolutionary. No one's ever thought of that before, except for every other animal on the earth.
Again, well said, Ken. So I'm hearing some common themes. So I'm trying to tease this out of our speakers. And the common themes is that the hormones and the calories are somehow interrelated. And, I find long term with our patients that the low carb is really a great way to control appetite. You said, I don't care if it leads to a calorie deficit or not, but I think in my clinical experience, people just end up eating less because there's less of them. And so it's not calories in, calories out. That's why I try to use the term energy balance. And I just like to make the point to our audience that I've even given lectures where there's these two camps. But at the end of that little section, I say we come together and to understand that there's aspects of it that are both important, and that perhaps we shouldn't be fighting with each other. But the biggest common theme that you mentioned is, what are the animals doing? They're just following their instinct, and I'm going to call that mindfulness. And so you pay attention to the signals from your body, and we give the tools to provide the right foods that tend to do a better job to control appetite, so people aren't hungry and maybe end up eating less, and certainly staying away from industry foods that are processed and are manufactured to drive us insane in terms of wanting more.
Yeah. So what causes the animal in the wild to seek out food? Well, it's their hunger hormones, right? And then when they found a supply of food and eaten all they can hold, what tells them to stop eating? They're not self-aware enough to know, oh, I've eaten 1,800 calories, and for my size wolf, that's enough. I need to stop, or I need to eat just a paw-sized portion of sheep, of mutton, of one of Dr. Berry's sheep, and then that's enough. I need to stop. They don't stop eating until something tells them to. What is that tells them to stop eating? Satiety hormones. That's exactly what it is. Well, we have those same hunger hormones and satiety hormones that they do. So no wolf counts calories. No wolf counts portion size. They don't do any of that. And they also are not, the term you used, they're not aware or they're not reflective. Like they don't turn off the television and eat on a small red plate. They don't do any of that shit, right? They're constantly alert and aware. When they're eating one of my sheep that got out of the pasture, they're constantly looking for other predators. They're looking for danger. They're looking for me with my shotgun. They're looking for all that stuff. They're not focusing on their food and enjoying every bite and all these foolish things that we're told to do that will somehow magically help us lose weight. They're not doing any of that, and we don't have to do that either. Only if you're eating improper food do you have to play those, what I call reindeer games. It's just silliness. It's busy work. It's foolishness. When you're eating a proper human diet, you get to listen to your hunger, and you can actually hear it, as opposed to addiction or boredom or all stress, which is what the big food manufacturers, they love to play on your emotions. They want you to be an emotional eater. They don't want you to be a hormonal eater. And so I try to listen to my hormones, but they don't like that, because then I wind up not buying any of their prepackaged crap. And neither does any of the people who adopt the principles of a proper human diet. They stop watching television commercials. They stop responding to that, buy one, get one free. They don't care. They have one question: is this proper human food or is it not? And there's a set of principles that kind of defines what that is. And once you understand those principles and you get it, you don't have to be aware. You don't have to be present. You don't have to be any of those kind of colloquial, popular terms. You don't even have to chew your food 32 times, Dr. Gerber. You can scarf it. You can wolf it down, just like a wolf does when he's watching for me with my shotgun. He doesn't chew that sheep 32 times. He chews it just enough times to be able to swallow it without choking, and then he gets on about his business. Guess what? We can do that too. There's not a shred of research that shows that you should chew your food 20 times or 30 times or 32 times or 100 times, like the one guy back in the 1920s said. There's no research to support that. No other animal does it. Every animal on the planet chews their food just enough times to be able to get it down their gullet without choking. And that's what they do. And we can do that too. And so there's so many of these things. It's just foolishness that's become very popular and very faddish to say. And you can even get research grants to figure out whether you should eat on a big blue plate or a little red plate, or this or that, or turn the TV on, turn the TV off, eat in private, always eat with a family, always eat with someone else, never eat with someone else. There's all this conflicting information. And when you whittle away all the chaff and all the bullshit, you're left with kind of a set of principles that, whether it leads to a calorie deficit or not, as I said earlier, I don't really care, because the calorie is a unit of heat measure. It's a heat measurement. It has nothing to do with the metabolism and the digestion of food. It was falsely applied to that decades ago. And I don't know why it's such a sexy and seductive thing, but there are so many people out there that just cannot give it up. I don't care if you're in a calorie deficit. I want you to follow your ancestral drive to eat and listen to your hormones about when it's time to eat and when it's time to stop eating and when it's time to eat again. And when you get that, and when that becomes part of your personal paradigm, this is how I eat. Big pharma can't trick you anymore. Big food can't trick you. They just can't, because they're never going to come up with a product that stimulates your satiety hormones, because if they did, they would immediately go broke.
Yeah. Well, I think we are similar to the animals in terms of looking back at our genes and from an ancestral perspective. But the issue on top of that is that we're really living in an urban jungle where, we have access to too much food, and sometimes
Sure.
the food is just unhealthy for us.
Well,
And
I would correct your statement and say we have access to too much pseudo food. I don't think we have. I think many people in the United States, even in one of the wealthiest countries in the world, they don't have access to much real food at all. They live in food deserts. They live in food apartheid. There's plenty of Cheetos and Ding Dongs and honey buns and Oreo cookies and Pepsi Cola. Yeah, there's plenty of that. But then you start saying, well, what is your actual definition of human food? Do those things qualify as food? And so I would respectfully disagree. I don't think most people have access to too much real human food. So does that make sense?
yeah, no, thanks for qualifying that. And in the third world countries, it's interesting that they're not eating enough, and yet they suffer from metabolic disease.
Exactly.
And I was going to say, one of our other speakers, Bill Schindler, he's actually an anthropologist, and his topic is going to be very specific to looking at how there's a disconnect between, the food that's available to us in the food desert or the food jungle, and and our genes. And
Yeah,
so,
and I'm very excited to meet Schindler and shake his hand and listen to his lecture. Also, there's another guy who's going to be there, Lane Norton, who I'm very excited to meet. He's currently a big advocate of the calorie in, calorie out model, and I can't wait to shake his hand. He may or may not shake my hand. I'm not sure, Dr. Gerber, but I'm excited to hear his lecture. I've told people for years on Twitter that Lane Norton's a very smart fellow, and he follows the research very closely. And I think as more and more research showing the obvious benefit of a low carb diet, a keto diet, even a carnivore diet for reversal of obesity and overweight, reversal of fatty liver, type 2 diabetes, pre-diabetes, metabolic syndrome, hypertension. I think as more and more research keeps coming out, as it inevitably is going to, because we know we're right, don't we, Doc? At some point, he will be a low carb advocate, and he will stop talking about calories in, calories out. And I'm sure that I would get a heated reply from him if he could reply to me right now. But I'm going to make this prediction. Just watch Lane carefully. Give him 5 years. I'm very thankful and very proud of him for coming to the low carb conference. But I think in 5 or 10 years, you'll notice that Lane Norton is a big low carb advocate, and he didn't talk much about calories in, calories out.
well, thanks for bringing up Lane. And yes, we thought it would be really important to have Lane come and share his perspective. And
Yes.
look, like yourself, he's an agitator. I mean, I put you in the same category, and we've already done a podcast with him, and you should critique the comments from his podcast, and I'm sure he's going to critique the comments from this podcast.
Absolutely.
Yeah, but again, I'm looking for some common themes, and Lane would even say that, perhaps his, he's aggressive, and perhaps, his message is misunderstood. And it should make for a really fun conference. And look, we want to keep it professional. We're joking, no fist fights in the aisles.
I have great respect for Lane Norton. I applaud him for coming, and I respect his academic acumen, intellectual and scientific debate. It's adversarial by nature. It's always been that way, and I wish it weren't. And I think some people thoroughly enjoy it, but I don't. I wish that we could sit down and have very calm, peaceful conversations. And I wish that when it's proven that the gray-haired gentlemen who currently run some arm of science, when it's obvious that they've been wrong for 30 or 40 years, and some young buck has done some new research and been like, dude, you've been wrong this whole time. I wish that those elderly ladies and gentlemen would have the circumspectness to understand their impact on society at large. If I stick to my guns, even though I've obviously been proven wrong, but I only have 3 years to retirement, right? And so I'm going to stick to my guns until I retire, and then I don't care what happens. I wish that weren't the case, but it is the case currently. And that's why folks like you and Nina Teicholz and others who are trying to work at this from a top-down model, that's why it's so glacially slow. Some prominent scientists once said, I think it was Feynman said, that science progresses one death at a time, because you have to wait for the old gray-haired scientists to die before the new scientists, who are obviously right about this thing, get heard. I wish it weren't that way, but unfortunately it is. And that's why very early on in this process, I decided to just ignore the powers that be. I'll yell at them and make fun of them, but I'm not going to try to change their minds. I'm just going to reach out to the people and say, hey, are you sick and tired of everything you've been told not working? Try this. I think you'll be pleasantly surprised.
Well, it's great to come at this from all angles, for sure. And, I agree that, science has always been debate. That's how it's set up. And it would be great if, the older scientists will say I was wrong, and it just doesn't work that way.
No.
But, I like to joke that, on social media, it's no fun if there's not a debate. So there has to be two sides to the story, or we don't have social media.
That's kind of true. Yeah, that's true.
Yeah.
But I wish that when somebody was obviously proven wrong, I wish it didn't take 10 or 20 years for them to come around and say, no, I got that completely wrong, didn't I? I get to keep all that research money, and I get to keep my tenure, and I get to keep, all my publications. But yeah, I was completely wrong about all that. I wish that, all of us were big enough to admit that, but many of us aren't. And that's just the way science is currently set up.
Yeah, I agree, Ken. So we'll just finish up. And I always have to ask at the end, what is it that you enjoy about coming to these events in person?
I enjoy hearing new thoughts about nutrition and medical research. I really enjoy that. I love it when somebody's perspective doesn't match mine. Those are usually the lectures I tend to actually attend. But my first love is to meet people whose lives I've impacted in some way, and for them to tell me their story. Let me tell you what your YouTube video did for my life. I love it when people come up and shake my hand, and we take an us-y together, and they're like, yeah, or a spouse comes up and says, my wife's too shy to come up to you, but you've literally transformed her health. She's standing right over there, and you know what I do at that point? I gallop over to where she is and give her a big hug and make her tell me her story. I don't tolerate shyness. If you're in my presence, you got to speak up. But I love meeting the people, hearing their stories, their success stories. I love hearing their failures, and then how they figured out, yeah, you were right, but I had to do it this particular way for me, or whatever. I love the real stories of real people who have taken the words from you, from me, from other people in this space, and literally now they have a degree of health, Jeff, that they never thought they could even dream about having again. That's gold. I love it.
Oh, it's great to hear that, Ken. So how can our audience find out more about you?
So I have a little YouTube channel. And I think at this point, I've got over 600 videos on there. So the best way to find videos by me that are relevant to you is to just go to YouTube and search Dr. Berry, and then whatever medication, medical condition, symptom, whatever. So Dr. Berry dermatitis, Dr. Berry hypertension, Dr. Berry fatty liver. That's the best way to find my relevant videos, because you don't want to scroll through 600 videos looking for the one that applies to you. If you want to find me at my snarky best, follow me on Twitter. If you want to see me at my loving, gentle best, you can follow me on Facebook or Instagram. I'm pretty much on all social media, because like bank robbers rob banks, because that's where the money is. I'm on social media because that's where the people are, the people that need help, the people that are searching. I'm on TikTok, Jeff. Can you believe it? Because there's people there who are sick saying, how do I fix my acne? How do I fix my obesity? How do I fix my eczema, my psoriasis, my rosacea? And if one of my videos pops up and that leads them down a rabbit hole to better health, they win and I also win.
TikTok, what's that?
Yeah, exactly.
Yeah, we're actually on TikTok a little bit. So that's great, Ken. And so to our audience, if you want to hear more from Dr. Ken Berry and other speakers, please consider attending our conference. And for more information about our conference, visit lowcarbconferences.com.
I'll see you in Denver.
In Denver in February 2023. So that's all for now. And again, thanks, Ken. And we're looking forward to seeing you at the conference.
See you there. Thank you, Dr. Gerber.